this is Gloria Likens. I'm doing my health assessment for my health assessment final. This is Christy Schaefer. She's going to be my volunteer today. I'm going to start with general appearance. General appearance is Christy is a 5'5", medium statured female. Her weight is 185 pounds, which converts to 84.1 kilograms. Christy, have you lost or gained any weight in the past 6 months?
No.
Describe your appetite. Is it good, fair, or poor?
Good.
Do you have any food intolerances?
No.
Okay. What would you say would be your daily fluid intake? Would you say about 1,000 cc? Would you say about 2,000 cc?
Well, let's see. Probably about 4 16-ounce cups, so
About 1,000?
Yeah.
Okay.
Of that nature.
Okay. Would you like to gain or lose any weight?
I'd love to lose weight.
Do you have any problems with vomiting, swallowing, chewing, or indigestion?
No.
Do you have an active or sedate lifestyle?
Depends on the season.
Okay. All right. So, motor activity. Christy works here with me at our clinic, and she has no problems with motor activity. No unsteady gait of any sort. She does not admit any or have any body or breath odors that I am aware of today. Dress, grooming, and personal hygiene, or she is clean, bathed, nails are cut, no dirt is underneath the fingernails. She is in a good mood and has good manner. Her speech is extremely well. She is very articulate. Facial expressions are normal. She appears in no distress today. Her respiratory rate, the abdominal would be, her abdominal, just upon watching her, would be 16. And if I do a diaphragmatic respiratory rate, which I'll do right now, and I'll do this for 15 seconds and times it by 4. And that was 4 inhalations and exhalations. And then times that by 4 would be 16 total in 1 minute. So radial pulse, and we gather that right here. And I will check that for her. That pulse rate is 88 radially. Apical would be, I don't know if we need numbers for this or not, but her apical pulse would be right at the apex of the heart, which would be right about here, which is close to the diaphragm. Upon that, I got about 80. This is a regular pulse rate because pulse rate is typically between 61 and 100 beats per minute. Her temperature, we do not have an axillary or tympanic or rectal temperature here. We have a thermal scanner. In the thermal scanner, we go across the forehead, and we stop at the neck for it's a range point, and that is 97.7 degrees Fahrenheit, which is completely normal. Next, we're going to do the blood pressure, and I'm just going to do her left arm, and I will do it at a sitting and standing position. (112/60), and then I will have her stand for me. 122/70 at the standing position. Those are completely within normal range. All right. All right, so I'm going to inspect her skin. Color is normal color. I see no bleeding or vascular problems with her fingers, hands. I see no visible lesions. Vascularity, her skin appears normal, does not feel no purple underneath the bedding of the fingernails. So all of that is perfect. Her skin is moist and she is very warm to the touch. I feel no coolness on the skin. Can you say that if you have any tenderness on any parts of your body right now?
Do not.
Okay. The color for her, I would go with a pale to pink in nature. I see no dusky, cyanotic, or jaundice or mottled-like features on her. The texture, she is very thick skin because she is she's not older or geriatric. So her skin is perfectly firm, supple, and not fragile or dehydrated. I see no physical edema on Christy. I'm going to actually look at your feet.
Oh, my feet?
Yeah, I want your feet. Give me your feet. I gotta check your pulses on your feet anyway. Okay. All right, so she has no edema pitting at this point. Okay. Her turgor has really good reflexes, so she is a very dehydrated female. Let's see. Ankle girth is normal for her size.
No cankles here.
No cankles. Next, we're in your shoe off for me, if you don't mind. Okay, next we're going to inspect her hair. Her hair is brunette in color with, she has blonde highlights. It's distributed correctly. I don't see any physical places of patches where there is no hair. So that's good. I see no visible lesions on the scalp of the skin. Okay. Texture of the hair, it's I would say medium to thick, not thin, and it's evenly distributed. Next I'm going to go to her nails. Nails are, I guess it would be clear. They are the normal color. They're not too dark, they're not too light, or they're not misshaped. You can tell she doesn't bite them. That's good. Shape is normal. There's no bedding to the nail, and they're configured correctly. So head and neck region we'll move to. Inspection, the shape of the head. Chrissy has a round face. Her scalp, once again, is of normal appearance. Sorry. Her face is symmetrical, no drooping on either side. Shape, once again, is round. All features are normal. I see no visible acne, scarring of any sort. Palpation and auscultation of the mandible. I will put your face for a second. Okay. So I'm looking at her mandible. Her mandible looks normal on both sides. She states that there's no pain on this part of her face. And I will palpate. I feel no spurring. She doesn't complain of any pain. All right, so I'm going to the neck. I'm looking at her jugular veins. I see no distension on either side. Trachea is midline. I'm going to inspect the thyroid gland. I do not see any visible nodes, and I will do the anterior and posterior approach of the thyroid. So I'm going to have you lean your head forward. Once again, there's no visible lymph nodes. And then I'll have you go backward. And then I'll have you swallow.
Good.
And yes, the thyroid moved as it's supposed to. Okay. Once again, the lymph nodes were all clear, normal, all rubbery upon palpation. Okay, so next we're going to do distance and vision. So hold on one second and I will get our Snellen chart.